Triangular fibrocartilage complex lesion by MichaelDeanDipoObadina. So what's the TFCC and what injuries affect it? TFCC is the cartilage complex at the distal radial ulnar joint. Is composed of cartilage, an articular disc, several supporting ligaments. It's the primary stabilizer of the distal radial ulnar joint. The lesions of the TFCC are classified on the Palmer scale, types 1 and types 2. They have subtypes A, B, C, and so on, depending on what the severity and the specific type of injury is. Okay, so the big reason the TFCC is injured so often is because it's a primary stabilizer of the wrist. Now, the wrist is absorbing a lot of forces. It absorbs compressive forces constantly. Think about if you're a bench presser or if you're doing even push-ups, that TFCC and that articular disc are absorbing all the weight of the hands throughout the kinematic chain all the way up to the rest of the body.
So our patient is Mr. Priest. Mr. Priest is a 25-year-old male carpenter who likes to spend his weekends fishing on his boat. So Mr. Priest came into our clinic complaining of wrist pain along the ulnar aspect of his wrist. He complained that during pushing movements that he was having some pain in his wrist, along with pain during hyperextension and ulnar deviation.
When Mr. Priest came into our clinic, we noticed that he had no real signs of discoloration or swelling in the wrist at all. We did notice that he had a bit of guarding. He was reluctant to use that wrist, but otherwise we weren't noticing a lot of physical deformities. So we moved into our palpations. We didn't get a lot of pain upon palpation anywhere except for that right wrist. We noticed some pain while we palpated the carpals, and we noticed some pain when we palpated the medial aspect of the wrist. So we tested all of his ranges of motion, both actively first and then passively. We noticed nothing remarkable except for his wrist motions in his right wrist. So we tested flexion, extension, radial and ulnar deviation, as well as pronation and supination. And in those motions, he was always painful. So we had to decide between surgical or non-surgical interventions. As PTs, of course, we're looking at non-surgical interventions first. Conservative rehabilitation is almost always indicated, so we've decided to go that way. The big difference is, and the reasons we want to avoid surgery, if at all possible, is that we want to avoid infection, we want to avoid potential surgical adhesions, we want to avoid any kind of extra scar tissue formation that may come from actually having to do an open or even an arthroscopic surgery.
So we're in phase 1 of our rehabilitation process, and the main goals of this phase are to reduce pain, reduce muscle spasm, and decrease edema. So even though there's not a lot of edema with this type of injury to the TFCC, our patient is experiencing a good amount of pain. And so we're going to use NSAIDs to decrease the pain. We're also going to use rest just to give those structures some time to try and heal and reduce that spasm. We're going to use ice, and we're going to use compression and elevation just to try to speed up the recovery time and get those structures back and out of pain and out of spasm. So we're in phase 2 of our rehabilitation process. Goals of this phase are to reduce adhesions and to increase range of motion. So we're going to reduce adhesions by doing some massage on the distal part of the forearm and the wrist right here on the ulnar side. Just trying to open up some of those tissues, increase blood flow, and get some stuff moving around there. And then to increase range of motion, we'll do some stretching in the wrist and flexion, extension, pronation, supination, and radial and ulnar deviation to help open up some of those tissues and restore some of that range of motion lost. All right, so we're gonna do some effleurage massage here on the wrist to reduce adhesions. We're just gonna start distal, all right, working our way through and coming here proximal, just trying to get rid of some of those adhesions that occur throughout this injury. Do some stretching of the wrist here to open up some of those tissues. So we're just gonna passively move him into some flexion, right? Holding each of these positions for 30 seconds to a minute. Then we can go into some extension here. Then we could go into some ulnar deviation, just being wary of too much pain. And then we go into radial deviation as well. And we can go supination, okay, and then the pronation.
We're in phase 3, we're in the resistive phase. So right now we're gonna try to increase some strength, restore some proprioception, and restore muscular endurance. We've got several exercises we can do for this. Today we're gonna demonstrate the weighted wrist curls. We're gonna demonstrate the wall ball ABCs, and we're gonna demonstrate the towel roll up and the unroll. Okay, so we're gonna do a simple weighted wrist curl going from extension into flexion. We can change this grip so that we can work our deviation. In this case, we're working our radial deviation, but it also eccentrically controls our ulnar deviation. And then of course we can work backwards and work our posterior wrist compartment. Wall ball ABCs here, and what's happening is that my wrist is constantly going into flexion and extension as I'm moving this ball up and down the wall. We can move it laterally and medially and get that pronation and supination of the wrist, all while placing a bit of stress on the ball as comfort allows. All right, so we're going to demonstrate towel roll-ups. As you can see, we're constantly moving into flexion, and we can unroll, go into extension. This also brings in accessory motions. You're going to notice that you're radially and ulnarly deviating as you do this, as well as pronating and supinating.
So we're in phase 4 of the rehabilitation process, the aggressive phase. Here we're going to be working on plyometrics. And for plyometrics, we're going to have him bouncing a basketball on different surfaces, and he could also do some clap push-ups. Then for the functional activities, we're going to have him doing some weighted casting, simulating the casting of the fishing pole. And we're going to do the dynamic pronation, supination, simulating some of his activities at work, where he's in a dynamic range of motion, dynamic position. And then for our activity-specific or performance-specific movements, we're going to have him doing the actual dynamic hammer swings, and then we're going to have him doing the casting and reeling of the fishing rod or fishing pole. All right, so what we have there is the basketball bounce against the floor. We're using this movement for proprioception, and we're getting a lot of flexion and extension of the wrist there, pronation, supination, being able to control the ball, right, and that speed of and force production, moving the ball against the ground. So here we're going to be doing the weighted casting, and this is simulating the fishing, right, that our patient likes to do. So just getting him used to casting that pole, getting in the wrist ulnar deviation, radial deviation, right, and just getting used to those movements right there. All right, so here we're going to do the dynamic hammer swings. This is a performance-specific activity that's going to be used to simulate what he's been doing at work. Now, we don't have a hammer, but we're just going to use the 5-pound dumbbell to simulate the hammer, pretty much the same thing. So if he's got to be in an extended position right here, just coming up, coming in a flexion extension. If he's got to get over here, a little bit of ulnar radial deviation, just in all these different positions, right? So just having him have different targets here that he has to go hit, right? As if he's just hammering away.